unmute yourself, go ahead.
Sure, I don't mind. I'm Nancy Nowak, and I am a senior advocate with Disability Rights New York. And I'm also a member of most of the DD citywide councils, DD councils. I'm happy to be here.
Hi, Nancy, thank you.
I'll
Anyone
go.
else?
Sure, I'll go. I'm Rochelle Kibanowski. I am a parent of a 42-year-old wonderful man with IDD, and I am the family vice chair of the council.
Good evening, everyone. My name is Marjorie Antoine, and I am the Senior Vice President of Education Programs for Birch Family Services. I've been with Birch for over 30 years in the capacity of educator, program director, coordinator of services, principal, and assistant principal. I'm very happy to be here this evening, excited for our new chapter as we've changed the direction of the course of this meeting, and we're hoping that we're going to have more folks join us. So please share the word with your networks so that we can make sure that we are providing the support and services that we need to our families in Brooklyn. Happy to be a part of this committee. I'm no longer the co-chair of the Meaningful Day Committee, but I am still the provider co-chair of the Brooklyn DD Council, as well as a standing board member of the Interagency Council.
Good evening. This is Christopher D. Greif. As some of you may know me as the treasurer of the Brooklyn DD Council, correspondence secretary, chair of the outreach with the Brooklyn Advisory Council, and my other hat, which I'm
Chris, we can't hear you. We can't hear you.
Sorry, my
You
microphone...
sound very, very muffled, very behind.
Yeah, let me see. Can you hear me now? Can you hear me now?
No.
Okay. I will give me a few minutes. I'll fix my microphone.
Yeah, I think you have to try again. We can't hear you.
So I'll go next. Nigel Thompson. I'm a parent as well, 20-year-old autistic young man. Co-founder, co-executive director of Kindred Bakery BK, and I am also the secretary of the Brooklyn Disability Council.
Hi, Nigel. Okay, anyone else?
Can you hear me now?
Yes, there you go, Chris.
Good. No, I just rebooted up the signal. This is Christopher D. Greif, the treasurer of the Brooklyn DD Council, the Advisory Council's correspondence secretary, outreach, and New York City Transit Riders Council member, exec member, actor, community outreach officer for actor for accessibility for MTA, Long Island Railroad Metro North. And also representing the Amtrak Accessibility Committee as well. And I did say I'm treasurer, too, for the Brooklyn DD Council.
If anyone else would like to introduce themselves, go ahead. I see Aaron is, there you go.
Hey, good afternoon, everyone. I'm Aaron Schmoeli from Goodwill Industries, an assistant vice president at our organization. I work with Jillian. I'm also on the board of APSI. And my hat that I wear a lot is for OPWDD and Access VR supported employment and a lot of employment-based programs. So nice to be here.
All right, I'm not sure if anybody else want to thank you, Aaron, for joining us. I think that's it. Okay. Trudy, Marjorie, you're up.
Hey. Can you see my screen? Yep.
Yes.
Perfect. Let me just. Okay. All right. Okay. So we decided to begin our topic on the school age as far as updates and the latest updates that we have received in the education from State Education Department is the FAPE 22, Free Appropriate Public Education, especially for in the special education services for students with intellectual and developmental disabilities. And we thought this was an important information for parents or other agencies to know as we have been tracking the changes since actually 2023, when the Court of Counsel recommended for students to graduate at the age of 22 in July of 2023. However, there has been many communications between the district and state ed as far as decision whether students should graduate at the age of 22, and if that's the case, when. And so let's start with what is FAPE in terms of supporting students that have IEPs, individuals with education plans, through the age of 22. It's free appropriate public education. It is mandated by the Individuals with Disabilities Act, and it ensures a special education and related services for students with disabilities until the age of 22, and it must be provided at no cost and meet state educational standards. Historically, for the past, ever since we've all been in the education, FAPE would actually end at the age of 21, typically. And what does that mean? It means that in the past, students who would turn 21 from September through June, they will graduate, they will stay on that year, on their school year. They will graduate and transition to any value outcomes that they've planned with the school and the parents and care managers or any other service providers. There was never, the law has always been that the students would stay for the school year. For those students that turn 21 in July or August, they would be entitled to receive that summer service within that year, and they would finish receiving special education services. They will receive an IEP meeting through the Committee of Special Education. They will get an exit summary, and in that exit summary, it pretty much states their plans after they graduate from high school. However, since July 2023, from a case of Connecticut, it was actually recommended for students to be entitled to receive special education services until the age of 22, as long as they have not received a high school diploma. So now it's extended through the age of 22 under certain conditions. There has been discussions back and forth for the past year between 2024 and 2025 between State Education Department and the districts in terms of students graduating until the age of 22. Based on the guidance from New York State Education Department and recent case law, students can now remain in high school through the end of the school year in which they turned 22. This is the most recent guidance that we actually received in September from the district. The stated guidance actually states that students are recommended to stay until the age of 22nd birthday. So as we all know, students turn 22 in different months, right, within the school year. So how would that work for schools? That would have been a planning, an ongoing planning for the schools, for the parents. And this latest guidance as far as 22nd birthday came out literally on August 14 from the State Education Department. So what does that mean? That if you had students, for example, turning 22 between September and December, going by that state guidance, they will have to finish and graduate and start planning right away for transitioning to adult day programs or college experience program or college program or any plan based on their value outcomes. Since the state guidance came out very late, then the districts have been recommending for students for the year 2025 and 2026 to stay until the end of the school year when they turn 22nd, 22 between September through June 2026. How does that affect then for students that do not receive a high school diploma, that they receive a SAC, which stands for Skills and Achievement Commencement Credential Certificate? For these students with IEPs who participate also in the New York State alternate assessment. For those students that participate in alternate assessment, they receive a certificate of attendance, which is the SAC, or the CDAS, which does not lead to a high school diploma. That basically reflects achievement and skills in standard-based curriculum, right? And once they receive that certificate of attendance, that's when the parents and the school will have to start planning in advance as to what is the next step after they graduate from high school. How does the certificate of attendance, such as the SAC and FAPE, receive that and updated eligibility? So based on the discussions between the district and state ed, for the school year 2024, 2025, 2025, and 2026, it is under revision and it is subject to change. So students earning a certificate of attendance must receive a written assurance that they can stay enrolled to receive special education services. It is very important for the schools to get in touch with the districts, so then the district can support the schools to ensure that the students will be receiving special education services until the end of the school year. And as of September 9th or the 10th, that's when districts send guidance to the schools to ensure that the students are eligible to receive services until the end of the school year, meaning June, right? And if students' date of birth falls on July or August, they're entitled to receive that summer service on July or August 2026. This eligibility to remain in high school through the school year in which they turn 22, not the 22nd birthday, but they turning 22 and they finish the entire school year. Please keep in mind that this is under revision and it is subject to change. We really do not know, we cannot foresee what's going to happen next year for 2026, 2027. It might be that it might go back to the law original, which is graduating at 21. So because there is still an ambiguity in terms of whether it's going to continue FAPE 22, it is important for schools to prepare those that are turning 21 years old. So the summer services for those turning at 22, again, is for those whose date of birth falls on July or until August 31st. They may receive extended services and it has to be coded on the student's IEP, and also entitles for them to receive related services, and students complete the entire school year. And so what are the next steps for schools? Review the district policies related to the Skills and Achievement Commencement Credential Certificate in terms of those particular students that are receiving a certificate of attendance and they have not received a high school diploma as far as FAPE eligibility. So for 2024, 2025, 2025, 2026, they're entitled to stay for the school year, turning 22 from September all the way through June, including the summer. For the following year, we do not know. So it is very important for schools to start preparing families for transition services. It is very important for schools to identify the students who may be impacted by FAPE 22, provide a written notice of eligibility to families and students. It is very important for schools not to exit those students, especially those that are earning a certificate of attendance at the age of 21. It is very important to wait for the guidance from the district. Ensure the IEPs are updated to reflect ongoing services and plan for extended school year if that is applicable for that student. And so that is pretty much as far as an update of free appropriate public education, age 22.
Thanks, Trudy. I also want to add that it's really important that parents understand that this is not a mandate, that they should continue to pursue services post-graduation for their individual as quickly and efficiently as possible. Because what we don't want to have happen is that students stay in school the additional year. Parents postpone the work that they need to do to secure those support services and ongoing services. And then we find ourselves in situations where students are staying in school an additional year, but parents have not done the necessary work in conjunction with the school to get the student ready for the next step in terms of their trajectory. So we are encouraging parents to make sure that they stay on course in terms of making sure that they're following up with their care managers and trying to secure services where they can. Because it's not a mandatory school year again. This is a parent's choice.
Thank you, ladies. We have a question in the chat from Nigel, who's wondering where the SCCC data can be found yearly, the yearly data.
That is through the New York State Education Department. You can find the data as to how many students receive it. More accurate information is through the New York State Education Department.
Yes, it's kept in their portal, in their data portal, so you can see the number of students who are actually receiving that type of certificate annually once they post it.
Okay. I know that we have on the agenda to talk about additional consequences to these updates. So Marjorie, I think you touched on that, that parents might opt to stay in because they think that it's mandatory for them to do so, or maybe they're not as comfortable moving on from school, and so they opt for the year to stay in. However, this might put a delay on their transitional services. So that's one major consequences to this update. And I would say as a provider that I've seen many times over, that the person stays a year and they might not have done some of the necessary appointments or for evaluations or something like that, or passed on a program because they decided to stay in school. And so I think from the provider point of view, one of the biggest consequences or changes that we've seen since this age adjustment, obviously, is the time frame in which people are transitioning to adult-based services is different. Typically, we're expecting, grads to come out of schools at a certain age and be ready to prepare for programs. So I think we had one year where we didn't really receive any referrals at all because students decided to stay. And then last year there was a really large influx of students because they stayed an additional year. So I think we might, as providers, see a trend of every other year on and off until this situation is determined and resolved. It's still currently under review. But I think as long as it stays to 22, we're going to see 1 year on, 1 year off, 1 year on, 1 year off of the number of people transitioning to programs. I would also suggest to additionally add that the biggest difference between providers and schools is there's not a mandate for placement post-graduation. So I think one thing that we could do as a group, as providers especially, is to talk to parents and families and explain that while yes, the school, if you opt and you sign in, they're required to keep you there for under that 22, the programs are not required to save an open space for somebody who is not necessarily transitioned properly, or they only have a certain number of spaces for programs that they can admit people. So if the person maybe started the process and then decided not to because they decided to stay a year and they were in the process of enrolling somewhere, that program might not have a space for them come the next June. I see another comment in the chat from Ellen. It says, how are the schools informing parents? The schools are obliged to create, in concert with parents, a viable transition plan. Yeah, that's true. I think, we don't have, I can't say that we have a big Department of Education rep on the call right now. So it's hard to say from other teachers in schools. I know that, Trudy and Marjorie are in the area of specialized schools, so they have, a lot more knowledge of what adult transition and stuff looks like, I think, than Department of Education, D75 schools. So it's really challenging, I think, for some of their teams to really convey this information properly. Chris, you had your hand up, and then Nigel.
just to add one thing, that what I'm also seeing that's going on, and I actually agree with Ellie, because it's not just District 75 we have to be concerned, it's non-District 75, because in all of the schools combined, doesn't matter what division they're in, there is still an issue, and I know Chris Trieper has said this already, and I actually just got a message for him, or something else. But we're seeing also school bus issues that it's in the IEP, and we're seeing there's transportation issues that's going on all over the boroughs. So that's another
Chris,
issue
I'm
that
gonna
needs.
pause you right there because it's on our agenda today, so we just haven't gotten there yet.
Okay,
But we are gonna talk about transportation and busing.
yes.
So I'm gonna pause you there just so that we can get
Then
to the next
then I'll get to
question.
my second question.
Okay, go ahead.
With the IEP, it is related because it's right here in front of me. Not all the schools are following the IEP. That's one thing we gotta watch in all categories, and that's where I'm gonna say right there.
Okay, thank you. Nigel?
Yeah, no, what I was going to say in regards to Ellen's question, so my son, he is turning 21 in December. Just last week, he's in a private school. They sent us an email asking us if we wanted to stay an additional year. Um,
Correct.
because the attorneys have been having these conversations.
Correct.
And we have, I mean, for the last year, we have been having conversations with them about a transitional plan for him. So, but that's the private school. I'm not sure how it's happening in the public schools, you know. Yeah.
Every school is
Right.
required to have a process,
Yeah,
whether or
they
not
all
you've
have
got folks
processes, right?
are capable of meeting the need. A lot of everyone's got turnover. It's, it's an industry where there's a lot of influx. Education has been in this space where things have been shifting for the last 5 years or so, but everyone is required to have a process. There's no one that doesn't have a process. I think it's just knowing the process and being able to navigate people through it successfully where you see some gaps, right? And that's usually based on the knowledge base of the person who's in that position. For us, like, we're not really independent schools. We're 853 providers. That's what we're called. It's a private but a public setting, right? We have to follow the transition plan as it's mandated by the state. So there are several transition assessments that take place. Parents are meeting with our transition specialist as well as with the school administrative team to make sure that we're having the family follow a course that's going to meet their students' needs. But again, I think a lot of this, the additional year, why it proposes an issue for some families, because to Pilar and Trudy's point both, you have families who stay the additional year, skip those necessary appointments and assessments that they're going to need in order to transition out successfully, and then they find themselves sitting at home for a year because the place that initially might have accepted them, now that spot is full. I have a family that's in that current situation right now, that there was a placement for him. And we kind of encouraged mom to move forward with that placement. We felt that it would have been a good thing for the student, good thing for her. It was a secure seat. Mom chose to stay with us in the additional year. And when she went back to that program, the seat was filled. And now she's waiting on a wait list to see if she can get a placement for her son.
So I see here in the chat, Ellen added a comment that includes the providers, the folks who are from OPWDD is the student receiving services. So I'm not really sure what you mean by that, but what I'm trying to understand is if you're saying if the student is in school and enrolled in OPWDD at the same time.
Yes,
Sometimes they are and sometimes they're
Sometimes they're
not.
not.
So that's,
but if they are, the service provider through OPWDD also has an obligation to inform the families.
correct, and they do. The challenge is who is the provider, right? So for school-age children, the person that is informing them is typically a care manager, right? It wouldn't be a ComHab staff, right? It wouldn't be a clinical staff. It would be a care manager that would inform them of this. So it's the job of this committee and others providers to share that information along with other providers, but they really, again, I think what Marjorie was saying is in different environments, there's different responsibilities of who's sharing that information.
Mhm.
So in a lot of these, there's 75 schools, they have a transition coordinator, they have a parent coordinator, and then those people also sometimes have to teach a class, right? So then how can they make sure that they're addressing all of this information? And for care managers, we already know that there's a large amount of turnover, and they might not be as focused on providing that information to someone that's in school, because the idea again is they're in school, they're receiving services, and it might not be as pertinent to, you know, make sure that they're all set up for these things. But what ends up happening is I think people underestimate the timeframes in which getting services takes, and enrollment and referral processes take for programs. So I want to thank everybody for that part of this. And I think we can transition from the consequences to, or the positives of students staying behind one more year, because there are some students that do need a little bit more time for that transition, and it might work in their best favor. So honestly, I'm sure there are pluses and minuses to the situation. With that, I think we also wanted to talk about busing. So I know that Marjorie and Trudy prepared some comments and some thoughts and some resources on that as well. So go ahead, ladies.
One of the working in a school and you know, for 20 years in the role of school administrator and doing busing, because I've done it for many years. Busing is one of the most challenging jobs, you know, in any school. Now, for schools such as A53 schools, all of the students are entitled to receive mini buses, right? And I want to say 5 years ago, a minibus was granted automatically, right? So after you did an IP meeting, you know, it was automatic, that student gets a bus, et cetera, et cetera. The change has been happening for the past 5 years, where if the student is not coded for example, minibus on the student's IEP, believe me, that student will not get a minibus. If that student is not coded for air condition, climate control, or limited time travel, or fewer students, there's so many verbatim in terms of these medical codes, they will not accommodate that student with those transportation accommodations. So I always encourage parents around this time. This is the time where I usually submit a form, the Office of OPT medical form, Office of People with Office of People
People transportation.
Transportation. I was going to say OPWDD. Office People Transportation medical form, in which the doctor has to complete the medical part, in which they state the accommodation. And then the parent has to complete the HIPAA form. Without that OPT medical form, that must be approved by the Department of Health District Office, by the way. It is not a form where you can just submit it and you get it. It has to get approved, right? Because they have to, I guess, measure, find out the medical condition of that student, if that student requires all those accommodations, including, for example, one-to-one bus para. Also, they measure the distance. If I want limited time travel, the school is located in Brooklyn, but I live in the Bronx, is that, you know, is that feasible for a limited time travel, especially now with the traffic and everything? They consider all those factors, whether those transportation accommodations requested can be approved. But it's always important for parents to complete that OPT medical form. Without that OPT medical form, that student might not be on a minibus, or will not be on a minibus, will not get AC bus, period, and will be on the bus for 4 or 5 hours. And even with the transportation accommodations, as Christopher mentioned, right? Oh, it's on the IEP, right? But if that code on that IEP is not entered into the DOE system, as a code, they will still not get those accommodations. Then it takes for the school to advocate for the parent with the router, with OPT, to ensure they shorten the route, to ensure that that minibus doesn't have 50 students. So it is best recommended that parents complete that form, that parents submit that OPT medical form, which has to be completed every year. And the school's responsibility is to advocate. We also have to inform parents that a lot of times when they call the customer service number OPT, oh, the school can do it for you, but they don't know what kind of school we are, right? They automatically assume we are public school in which we see everything, and we don't. We just get the information from the router. That's all. We get the routes, we get the accommodations, and then we start working on to ensuring that everyone is on their appropriate route with the appropriate accommodation. So it is very important for parents to complete that form, and it's important for schools to advocate to ensure that they're getting an appropriate ride and within the appropriate time.
And that's the school age. So preschool, there's a whole other level with this new system called Atlas that has to be, all the information is entered into the Atlas system for the preschool side, including that direct correlation with the rider system in OPT. So if your student is coded, to Trudy's point, if your student is, that code that delineates busing period is missed, forget about the minibus or the accommodations and making sure they fill out the medical, you will have no busing, which has happened to a few of our families because of the collaboration in terms of 3K and 4K that a lot of 4410 preschool providers are offering to families in terms of the extended day and the program, which allows students to stay until about 2:30 in school, just like they're typically developing peers. Lots of mistakes with the coding with the UPK code versus the special education preschool code. So we had a lot of back and forth in terms of families not being able to access have access to busing because the codes were input incorrectly into the system by DOE staff. So it's been a very challenging situation in terms of making sure that everyone is accurately set up in the system and receiving busing. To Trudy's point with our school age kids, even with the OPT form being filled out, calling every day before the student even starts, there's been some challenges with ensuring that busing is in place. But there's also rideshare. If there's a gap in service in terms of busing and you're not able to receive the busing, you are entitled to request rideshare until they are able to fulfill the busing obligation to you and your family. And that is making sure that you're reaching out to your district coordinator, making sure that they know that the busing has been an issue so that you can kind of help them facilitate that rideshare request. But that rideshare request means that there must be an adult member that's going to ride with the student to and from school. They will not transport you with the ride share if an approved adult member is not with the student. But that is something that I've been having families advocate for, that they should not be penalized because the system is not working efficiently, that they should utilize the tools that they have, and rideshare is one of them.
I just wanted to add that this morning on the news, I saw that an interesting story about the continued number of monumental numbers of students that are listed as homeless or considered without housing in New York City. And I think that this has continued to add an additional barrier for the students with disabilities and that need busing. So I think that we also as advocates need to really make sure that, we're being heard on this matter, because people that might be in the shelters services, and we're talking about thousands of students, not just like, hundreds, thousands of students, and they are often moved to other boroughs and then still have to commute to their school, and they need public busing or their bus to provide it to them. So I think, who do we contact for these students, and how can we make sure that their schools have the correct tools, or their parents have the correct tools to contact the bus company with what to do, because they obviously, needed additional support And I'm sure that that adds to the number of District 75 or other students receiving special education that are using the bus systems. Nigel, go ahead.
Yeah, no, what I was gonna say is what have worked for us, once we have all our documents in place, like what Marjorie just mentioned, is actually emailing, the, I'm looking through the email notifying the chairperson for that district.
Okay,
We have found that often enough when you could ring, you could call OP, whatever, call them, no, you know, they're not documenting anything, they're not picking up whatever it is. When we have been very successful with emailing directly whoever the chairperson is for that district, and within 2-3 days, believe it or not, problem solved. Like clockwork over the last 3-4 years.
okay. Perhaps, committee members, we could come up with a fact sheet of who these people are, and we could put that on our page for people as something they can just find out if, you know, who is their chairperson or who is their district person. I think that would be a good resource that we could put up on our website.
Right, right. I mean, and it's similar to almost to like when you're having problems with a care manager, you got to go up the chain of command,
Right.
and you're gonna get some results. Like I said, the last 3-4 years, this has worked. Like, you know, when we don't see stuff show up by a certain time, we email that person, and it gets done within 3-4 days. They start,
Yeah.
doing what they need to do.
Thank you for the tip. I see Rochelle's taking notes, so I'm assuming you're gonna bring that up, Rochelle? At our next general
Sure.
council? Okay, I saw you taking notes, so I'm like, I'm doing the chat and this, so I'm like, okay, I see you taking
A
notes.
little minimal notes, so don't
Okay.
count on it entirely. It's for
I'll
me.
do a note. Chris, go ahead.
Yeah, I want to back up what Nigel said. You know, I've been saying this many years already in the past. You know, we got to tell them, go to email them, put in the chain of command. But at the same time, we do need to remind a lot of the families that, you know, if you don't, you say you're going to do it, then they're expecting all of us to do it. But here's the thing: it has to be the parents got to do it first before, you know, you have evidence and notes and dots and all the letters, everything together. But you know, a lot of them just like go into their little thing saying, yeah, I'm going to do it. Next year's later, they still don't get it done. But then when you tell them to email this person, that district, yeah, it will get done. But you know, people got to realize it doesn't take like a snap of the finger. It takes time, days, and don't forget there's holidays too on this. But going on the transportation end, there is an increasement of families that are using not just the other company, but they're also using Accessoride, I'm seeing, because lately the Accessoride numbers are now up to additional 75% in all 5 boroughs we're talking about. Not just one, 5 boroughs that's combined. So they are using it, and they are using sometimes, I'm seeing sometimes they're using Oopers. And I'm not talking about the candy. I'm talking about the transportation, not the chocolate Oopers. It's kind of interesting how they're doing that. But at the same time, also, as I look at these families, like, wow, you have money. But at the same time,
It's not that they have money, they have no other choice. They're using Ubers and then probably requesting reimbursement or something else if they can.
true and
Because
false.
they can't. Yeah.
I'm gonna say true and false because they're both ends. And I'm going to say that because, Payal, you are correct what you're saying. But there is what I'm seeing is there are some families, all of a sudden they have this, and they don't realize when you explain to them in another borough, I'm not talking about this borough, I'm talking about the next door. It depends how they're doing it. And it's kind of strange because you can see in one parent, you see it from another parent. It's just that they just got to do an education point of getting it done. And the educationing is reminding them, because remember, I do the resource fairs every month with the library. We tell them to attend the meetings, get some information. get the agent all the information they need, but all as much we can do. But again, we still have to educate the schools in both ends, District 75 and non-District 75, in all the schools, because they got to remember that before they graduate, help them getting what they need. That's the key still. And there's some new stuff. And I know
Thank
Ellie,
you.
I know, I was trying to finish. I was saying,
Okay.
I was trying to say is Ellie, and I know what Ellie's been saying earlier. She's right, because some of the schools, some of the new transition coordinators are not familiar with us all. So we just got to have to put some ring the bell and say, hi, this is a council. Please make sure you share this to your families. Thank you.
That's correct. I do my best to share, but we can't really force families, and that's something that is really a challenge. If you do outreach work, getting people to actually join or participate is definitely a challenge. I can guarantee I've sent this meeting to community boards, officials, all types of things, and it is what it is. And I still see today that we don't seem to have many families other than those that we are already familiar with. So we know Mr. Greif, we know Miss Rochelle, we know Nigel. I'm not sure if there's any other families that are on this call, which kind of brings us to our next parts of the agenda. So we can put some of them to the general council, but these were more questions for parents and families. One we have on here as a reminder, camp applications, they typically start in the winter months. So it's time to start getting prepped for those camp applications. I'm gonna just say it anyway because we're recording the meeting. So whoever watches the recording, they can get the reminder that camp applications will start coming out soon. We're probably not just yet, but definitely in the next coming months, camp applications will be coming out. So for parents to keep them mind out for that. We will have a presentation and some more information on camps and other programs that are available. So we'll plan to share that as well. My second note was to do a poll of the room of who has OPWDD eligibility or who has started the process. But since we have mostly providers on here, I'm gonna skip the poll, even though I did figure out how to do it eventually. So we'll just save it for next time. And then the next thing that was on our agenda was our plans for the committee chairs meetings. What do parents and families need? What kind of information do they want to see us present about? We have some slated topics and some pretty much general things that we know we want to share, but we're always open to questions, topics of concern, so we can add them to the agenda. Next month's meeting is going to be focused on parent advocacy. So specifically, we're going to have a presentation from Parent to Parent, which is an organization that provides parent support from other parents. And so they're going to present. And then we're going to talk a little bit more about parent-specific concerns. And it might not be about services. It might just be about wellness and other things for parents and how to learn to advocate for services, things like talking to supervisors, how do you find this information, where do you find it? So we're going to have that as our next focus for next month's meeting in November. I've asked any of the other providers here who are not already familiar with us and what we kind of share at these meetings, drop in the chat some suggested topics that you might like to see or that that the parents and families or the people you support could benefit from, so that we can plan to address it at some of our upcoming meetings. So if you're not familiar with our committee meetings and kind of usually how we operate, I know we usually touch on most topics, but if you haven't been to one of our committee meetings before, please drop a topic in the chat that you would like to see or you think that would be beneficial to people you support. I'm gonna hand off to my other committee co-chairs if they have anything else to add in the respect of people's time. I'm hoping some parents might still want to jump on, but it's already 5:30. We have another hour left without much info to talk about. So co-chairs, anything else you guys like to add? Go ahead, Jahida.
No, I'm just wondering, maybe hopefully maybe when we meet with parent to parent, they'll give us an idea of how we could get more parents on the call, because I really do think the fact that we're doing them in the evenings and we're trying to be flexible how many times and frequencies throughout the year, that we really would love to see more parents. So if anybody has an amazing idea, that comes to them at 3 in the morning, we're willing to
Yes,
take them
please
all at this
share.
time.
Yes. I've shared it out with District 75. I have so much, contacts in schools that I've worked with in my position. I share it with them. I know a lot of their teachers blast it out, send it home in backpacks and stuff. Obviously, within our provider network, it's being shared. I mentioned sharing it to our local government officials and community boards. A lot of them just have emails, so they just send us an email with the flyer and we share it. Some of them post it in their windows. So I know things go out there. Again, who's getting it, who's receiving it is the challenge. Homeschooled kids, there's a question, Memly Miller, any information for homeschool? I don't have anything specifically in regards to homeschool children. I'm gonna hand that off to the educators if they know, because I'm not an educator, so I really don't know what are the rules and regulations even for homeschooling.
Well, there are rules and regs. You can
Yeah.
go to your local district and, apply to homeschool your student if that's a choice that you have. And there is an assigned curriculum and format that they will provide you so that you can implement that at home. But you would have to go through the district and register yourself as someone who wants to have their student homeschooled, so that you can go through the process and still get the right assessments and be able to move through the system grade by grade.
Interesting.
And does that help? I hope that helps you.
That is
Yeah.
correct. Just to add one thing, with that's been doing now, they have been updated onto the computer systems, but the only thing is they do have a supervisor now watching them once a week. Just to let you guys know, they have changed that. Just to be alert, because we had someone actually ask that at a resource fair. Actually, Pearl, you were there with us in the one in Bev Stuyvesant. We had a family asking about that.
Okay.
2 months ago, and she has now signed up for that. And I know she's supposed to sign up for the councils, but I did, we have to make sure there's a link, because I know Carrie has some information about it as well. But I know parent to
Okay.
parent might have that more facts
They
updated.
might, yeah. So, Emily, I would say stay tuned for our next month's meeting. Parent to parent will be here. They might have some resources on homeschooling.
Thank you so
Any other, oh, I'm sorry.
I'll say thank you so much.
Oh, you're welcome. Any other, are you a parent, Memly?
Yes, I am. I have
Okay.
to,
And how did you get the information for today's meeting? Maybe we can try to
uh,
get where we
I-
can share it more.
my son is a participant at Kindred Baking with Nigel.
Nigel shared it out. Yes.
Yeah,
Okay.
I'm such a big advocate, So my kids are in both kids. Actually, I have 2 spectrum kids, autistic. They are in OPWDD program, self-directed.
Uh-huh.
So,
Wonderful. Yeah, Nigel's program is really great, so I'm
Yeah.
glad to hear it.
that's
And
amazing.
please share about our council to
I
your
will.
networks of parents and families. I think we just need more parents and families to tell other parents. That's the way we get it,
Yeah, of course, of course. I love to share and advocate for, for the kids and stuff. Yeah.
Thank you.
I
Thanks
will
so
say
much for
today is
joining
not
us.
a fair representation, Pilar,
Yeah.
because it is a holiday. So I
That's
think
true. It's a holiday, so
it's a
we're gonna move past
holiday.
today.
So we have to take that into
Ellen is in the
account.
chat also. Many folks ask about social programs that are in the community, painting, cooking. Yes, so we have definitely, as a meaningful day committee, that is a big area of our topics and discussion, is social skills, community-based goals and services. So that is definitely on the docket of agenda for what we plan to discuss. There will be a couple of meetings in which we'll talk about what type of social activities, whether it be recreational, day services, art-based programs, work-focused community volunteering. So we definitely will continue to share about all of those programs.
Some of the issue is that people on groups, particularly there's this Brooklyn Special Needs Kids, Manhattan Special Needs. There's a whole bunch of groups. Don't get me wrong. They don't want a program. They just want to go someplace and be a friend. They don't want to hear about how to get it paid for. They don't want to. They want to be able to say in two ways, this is a group for me as well as a group for my child. One of the things that comes across is extreme kids and crew or fast feets. They don't want to. They don't want our traditional language. I don't know how else to put it. We talk in a very different lingo. So,
Yeah, of course. And I think
and when we say it like that, it becomes stuffy.
Okay. Yeah, I mean, we invite those programs to come and speak and share about what they do. So it's not coming from like AHRC. So I know me and Trudy from the AHRC world, and a lot of us are from provider worlds. For the purpose of these councils, pretend we don't really work at AHRC, right? We are participating as the council separate from our work from AHRC. So we don't really share only like just specific provider programs. We also share things that are available out in the community. There's like autistic adults group that I know has presented before. They do meetups, they have all types of stuff. So we definitely will continue to encourage other groups and community stuff to share about what they're doing out in the community for people with disabilities. That's not a service, right? It could just be a thing. Thank you for that addition. Okay. 5:37. I want to respect folks' time, so I don't want to make people stay on here for, another hour if we don't have a large turnout. For the parents and families that we do have on the call, were there any other additional questions that might be specific to you that you might want some support with? Suggestion, maybe carve out some space. Yeah, that was part of the plan for today, Erin. Unfortunately, they haven't logged onto the call. So before we got on the call today, I was trying to figure out like our breakout rooms and a little poll and stuff like that so that people could connect and kind of do a quick session of what's their status and what they're working on, but we don't have them on the call to do it,
Yeah.
unfortunately. So we're gonna try it next time. We're gonna try it again next time. Yeah.
I was thinking, do you market the DD Council like through one or two of the principals at some of the local, some of the local schools?
Yeah, I do. So I'm working closely with a couple of the transition high schools in Brooklyn, specifically District 75, and then I have a few other schools like Cook School I work with. Obviously, I'm connected with the HRC Middle High School, so we share it. It's
Sure.
just the luck of the draw. Sometimes it's really hard
Sure.
to get folks on the call. Chris is in the chat sharing some stuff.
Yeah, there is one thing that it is important that this is for families, but it was mentioned on email because I know Brian has sent it out, and I know I did put this on my end. I know I put it on Facebook because half of us in this room who's here actually put likes. Thank you. Just letting remind everyone, tomorrow at 25 Beaver, they're doing the CAST training. One's in the morning, one's in the afternoon. So I just want to remind everyone on that as well. On just because of that. But our regular the advisory council meeting will be back on this normal day next month. We're supposed to have the New York City Department of Human Rights that will be joining with us to give some good training on disability rights, how to follow the laws and stuff. And everyone's welcome, especially it'll be a good turnout. I will send that out when it comes available.
Thank you, Chris.
Mm-hmm.
All right, folks. With that being said, thank you for everyone joining. I don't want to hold us here too much longer. Thank you to my co-chairs. Thanks, Rochelle. Thanks, Chris
See you
and
soon.
Marjorie, our other committee members, DD council members.
Bye, guys. Have a good night.
Have a good
Bye,
evening,
everybody. Have a
everyone.
good
Thank
night.
you.
Feel free to contact me if you have any questions.
Got you.
All
It was
right.
very informative. Thanks.
Thanks. We'll see you next month in November.
Mhm.
See you in November.
Bye
Bye,
bye.
guys.
Bye.
Bye.
Bye.